Hi, my name's Hadassah Adorno. I'm going to be answering the third section of the blood flow extra credit. So I'm supposed to be relating blood flow to the following: heart attacks, stroke, embolisms, hypertension, obesity, viscosity, and clogged arteries. I will also be answering two questions, which I'll mention later. So I'm supposed to relate blood flow to the following. Um, well, before that, actually. So this is a reminder that blood flow is directly proportional to blood pressure and inversely proportional to resistance. So viscosity, blood vessel diameter, and length. So for a heart attack, when you're having a heart attack, your heart stops pumping. There's no blood going through your body because your heart's not pumping it. So there's no blood flow to your heart or your brain or anywhere. And your arteries and veins and transport these to all your tissues and organs, which is how you receive your nutrients. So if you think of it as in terms of a highway, all of the cars have suddenly stopped working, so traffic's at a standstill, nothing's going on. So it's not transporting the necessary nutrients that you need. So for stroke, there's two primary causes of a stroke. It can either be the blocking of an artery or the damage of an artery. So it's like either leaking or bursting, something like that. So when an artery is blocked, blood isn't really allowed through, which means that blood flow is either stopped or it's significantly decreased to the point where it's not doing enough. It's not giving your brain enough oxygen. It's not giving your heart enough oxygen. It's not giving something enough oxygen. So when there's a leaking or bursting blood vessel, think of it in terms as like a broken straw. So there's a hole somewhere along the way up to the top of the straw. So when you start to suck through the straw, blood escape, well, the liquid, but in this case, blood escapes from the hole and you can barely get any. So this also means that the brain or the heart or something else isn't getting the nutrients that it needs. Bless you. Um, Embolisms. So embolisms are blood clots that break off and they travel through the bloodstream. So this can like end up anywhere. It can end up in the lungs, pulmonary embolism. It can end up in the brain, the heart, wherever else. Blood reaches a lot of places. So this increases like the traffic by taking up more space in the blood vessel. This can block off or partially cut off the blood vessel, which means a decreased diameter and increased resistance. This in turn causes blood flow to slow, so since there's not much wiggle room to pass through the blood vessel. So for hypertension, um, again, another reminder that blood flow is directly proportional to blood pressure. So hypertension, first of all, is prolonged high blood pressure. So while at first your blood pressure is increasing blood flow, since it's directly proportional, since there's prolonged exposure, it damages your blood vessels, since there's not enough blood reaching the tissues that need it, which can cause atherosclerosis, blocking off these blood vessels. So the end game is that your blood flow decreases or stops altogether, regardless of how directly proportional blood flow is to blood pressure. None of that matters once it's damaged. So for obesity, as a person grows, so does blood vessel length. The more area that's needed to cover, like to be covered, the longer the blood vessel needs to be. So when you gain weight, your blood vessels are going to need to stretch in order to reach all parts of your body that need that oxygen, that need the nutrients that blood can carry. So the longer the length of the vessel, the more pressure is needed to be exerted in order for the blood to get pumping and to go to where it needs to go. So going directly back to the directly proportional relationship of blood pressure and blood flow. That means that blood flow is going to increase until the strain catches up, and then you risk things such as hypertension, atherosclerosis, and cardiac arrest, etc. So moving on to viscosity, the thicker the blood, the slower it flows. Think of earlier in the video where Natalia is squeezing out honey from the container as opposed to water. She had to exert more force in order for the honey to go through, so more blood pressure. More force equals more pressure. For clogged arteries, the more occlusion in the blood vessel, the harder it's going to be for the blood to flow through the blood vessel, correct? So think of a highway. There's a bunch of traffic. You're one car out of hundreds on the 95. So if there were no cars around, you'd be able to proceed without a problem. There's no cars in your way, there's no maneuvering needed. But now you have a couple of cars, so now you're going to have to figure out a way to go around them, but you'll probably not have much of an issue since it's just a couple of cars. But then a couple of cars become a bunch and there's heavy traffic, so there's less leeway. So suddenly things aren't flowing too great, and eventually it's so clogged that nothing's going to get through, no matter what you do. So that's a problem with blood when your entire body needs blood in order to even function correctly. So, all in all, since the arteries are narrowed, there's decreased blood flow. Moving on to the two questions I mentioned earlier, I was asked what treatments are available to decrease resistance and improve flow. So I came up with three examples: blood thinners, angiograms, and stents. Um, Blood thinners do exactly what they sound like they do. They thin your blood, and they protect against blood clots. So they're also called anticoagulants. So they keep your blood from clotting, as I said, and it keeps your blood from thickening. So angiograms are both a diagnostic measure and a treatment. So using a catheter to enter the blood vessel, they can either identify and or treat the source of, say, like an embolism or something like that. So I believe I said something about that in my presentation video on myocardial infarctions and cardiac arrests. So moving on to stents, I actually have a bit of knowledge with this because my sister had a heart attack before and I'd asked the doctors a bunch of questions because obviously I wanted to know. So she had a complete blockage of an artery and so it led to cardiac arrest, not cardiac arrest, sorry. She had a myocardial infarction. So she was brought into surgery. They placed a stent in the artery to keep it from being blocked and leaving it open while the blood vessel healed. So this helped increase the blood flow, whereas before it was completely blocked off. The second question I had was, how does lisinopril affect blood flow and pressure? So lisinopril is an ACE inhibitor, which will block the production of angiotensin II, which is what helps raise blood pressure, and aldosterone. This means that it will help lower blood pressure and therefore it will also lower blood flow. So this is pretty much used for hypertensive patients. So they already have a higher blood pressure than normal. So they're going to need that to be lowered. It's probably not advisable for people that have normal blood pressure. So it can also be prescribed after having a heart attack, just like my sister did. So all in all, that's it for section 3, and we appreciate you watching our video, and thank you. Bye.